This video of mine is about benign paroxysmal positional vertigo, which is abbreviated as BPPV. This is one of the most common cause of vertigo, and vertigo is the sudden sensation that you are spinning or that the inside of your head is spinning. BPPV causes brief episodes of mild to intense dizziness. It is usually triggered by specific changes in your head's position. This might occur when you tip your head up or down, when you lie down, or when you turn over or sit up in the bed. Although BPPV can be bothersome, it is rarely serious except when it increases the chance of falls. You can receive effective treatment for BPPV during a doctor's office visit. Now I will tell you the symptoms. The signs and symptoms of benign paroxysmal positional vertigo may include dizziness, a sense that your surroundings are spinning or moving, which is known as vertigo, a loss of balance or unsteadiness, nausea, vomiting. The signs and symptoms of BPPV can come and go and commonly last less than 1 minute. Episodes of benign paroxysmal positional vertigo can disappear for some time and then recur. Activities that bring about the signs and symptoms of BPPV can vary from person to person but are almost always brought on by a change in head position. Some people also feel out of balance when standing or walking. Abnormal rhythmic eye movements usually accompany the symptoms of benign paroxysmal positional vertigo. Generally, see your doctor if you experience any recurrent sudden severe or prolonged and unexpected dizziness or vertigo. You should seek emergency medical care in the cases which I should tell you now. Although it is uncommon for dizziness to signal a serious illness, you should see your doctor immediately if you experience dizziness or vertigo along with the other symptom which I am going to tell you. If these symptoms are involved, then you should seek emergency medical care. And these symptoms are a new, different or severe headache, a fever, double vision or loss of vision, hearing loss, trouble speaking, leg or arm weakness, loss of consciousness, falling or difficulty walking, numbness or tingling. The signs and symptoms which I just told you may signal a more serious problem. If you suffer from vertigo along with the symptoms and signs which I just told you, then in that case you should seek emergency medical care. Now I will tell you the causes of benign paroxysmal positional vertigo. Often there is no known cause for BPPV. This is called idiopathic benign paroxysmal positional vertigo. When there is a known cause, this is often associated with a minor to severe blow to your head. Less common causes of benign paroxysmal positional vertigo include disorders that damage your inner ear or rarely damage that occurs during ear surgery or long periods position on your back, such as in a dentist chair. Benign paroxysmal positional vertigo also has been associated with migraines. To understand this benign paroxysmal positional vertigo, you should understand the ear's role in the balance of the body. Okay. Well, inside your ear is a tiny organ called the vestibular labyrinth. It includes 3 loop-shaped structures which are known as semicircular canals that contain fluid and fine hair-like sensors that monitor your head's rotation. Other structures, which are otolith organs, as you can see in images in your ear, monitor your head's movement up and down, right and left, back and forth, and your head position related to gravity. These otolith organs contain crystals. These are calcium carbonate crystals that make you sensitive to gravity. For many reasons, these crystals can become dislodged. When they become dislodged, they can move into one of the semicircular canals, especially while you are lying down. This causes the semicircular canal to become sensitive to head position changes and it would normally not respond to, which is what makes you feel dizzy. So this is the exact reason why you feel dizziness, because these calcium carbonate crystals which are present in this otolith organs are dislodged, and usually they move into these semicircular canals. Okay. Now I will tell you the risk factors. Benign paroxysmal positional vertigo occurs most often in people aged 50 and older, but can occur at any age. BPPV is also more common in women than in men. A head injury or any other disorder of the balance organs of your ear may make you more susceptible to benign paroxysmal positional vertigo. Although BPPV is uncomfortable, it rarely causes any complication. The dizziness of benign paroxysmal positional vertigo can make you unsteady, which may put you at greater risk of falling. So the falls can occur. So this can be a complication of benign paroxysmal positional vertigo. Now I will tell you about the diagnosis of BPPV. Well, regarding this, if you are suffering from benign paroxysmal positional vertigo, you can test about this at your home. First you need to do is you should sit on bed so that if you lie down, your head hangs slightly over the end of the bed. Then turn head to the right and lie back quickly. Wait for 1 minute. If you feel dizzy, then the right ear is your affected ear. If no dizziness occurs, sit up and wait for another minute. Then after waiting for another minute, you can turn your head to the left and lie back quickly. Wait 1 minute. If you feel dizzy, then the left ear is your affected ear. Through this way, by this way you can determine which vertigo is due to right ear problem or left ear problem, as you can determine yourself. Okay. When patients come to us, we also can determine through these type of ways, and we can do a series of tests to determine the cause of your dizziness. During a physical exam, we will likely look for signs and symptoms of dizziness that are prompted by eye or head movements and then decrease in less than 1 minute. Dizziness with specific eye movements that occur when you lie on your back with your head turned to one side and tipped slightly over the edge of the examination bed. Involuntary movements of your eyes from side to side, inability to control eye movements. This test is known as Dix-Hallpike test, as you can see on the images. So through these tests, we can determine whether you are suffering from right ear problem, and that is causing your all this vertigo and nystagmus, or you are suffering from this your problem in the left ear, because this all balance is controlled in this along with nerves in because this inner ear is connected with the nerves. Okay, and that is all responsible for your balance by connection with the brain. Okay. Well, sometimes it's difficult to diagnose. We cannot find the cause of your signs and symptoms. So in that case, we can order some other test. There are some obviously exceptions are there, and there could be other reasons for vertigo except this benign paroxysmal positional vertigo. So in those cases, we can do some tests such as electronystagmography, that is ENG, or video nystagmography. The purpose of these tests is to detect abnormal eye movement. ENG, which uses electrodes, or VNG, which uses small cameras. Okay. ENG and VNG are abbreviations for electronystagmography or video nystagmography respectively. Okay. So I was telling you that this test, that ENG uses electrode and VNG uses small camera, that can help determine if dizziness is due to inner ear disease by measuring involuntary eye movements while your head is placed in different positions, or your balance organs are stimulated with water or air. Okay. Then sometime we may order magnetic resonance imaging, that is MRI. This test uses a magnetic field and radio waves to create cross-sectional images of your head and body. Your doctor can use these images to identify and diagnose a range of conditions. MRI may be performed to rule out other possible causes of vertigo. Now let me tell you about the treatment. Okay. Well, in this regard, I would strongly recommend to watch my short video regarding the treatment, in which I have told about this procedure treatment, in which you can see a girl, lying and just getting up in different positions. Okay, and then that you can see that video, and that is really a very good way to treat your benign paroxysmal positional vertigo at home. Okay. You must see that video, and you can see I will just in this I button you can see this link of short video, and you can see that video right now. Okay, that is really helpful. And this treatment is very successful in majority of the cases. Okay, so you can for the right side of vertigo you can repeat it 3 times, and then for the left side vertigo you can also do it 3 times. Okay, and usually usually the symptoms of benign paroxysmal positional vertigo usually disappear, but sometimes you need to repeat these after like a few days. Okay, but in case that it is it's not going, then obviously you must see the doctor. Okay. So the treatment usually sometimes you should also remember that benign paroxysmal positional vertigo may go away on its own within a few weeks or months. It's without even the treatment at home or by a doctor, it can also diminish. It can also disappear within few weeks, but sometimes the treatment is very necessary. But to relieve this patient who is suffering from BPPV sooner, then we may treat you with a series of movements which are known as this canalith repositioning procedures. This epley maneuver is one of these canalith repositioning procedure, and this is very helpful usually. The goal of this epley maneuver is to move particles from the fluid-filled semicircular canals of your inner ear into a tiny bag-like open area that is vestibule that houses one of the otolith organs in your ear, where these particles do not cause trouble and are more easily reabsorbed. Each position is held for about 30 seconds, as you have seen in that short video. After any symptoms or abnormal movements stop. This procedure usually works after 1 or 2 treatments. Your doctor will likely teach you how to perform the procedure on yourself so that you can do it at home if needed. As I have already told you, you can see that epley maneuver in that short video, and you can do it yourself without any need of any assistance. Okay. Well, in rare, there is a surgical alternative also, and that is also in very rare situations. When the canalith, in some extreme situations, which is very rare, if the canalith repositioning position does not work, then we may recommend a surgical procedure. In this procedure, a bone plug is used to block the portion of your inner ear that is causing dizziness. The plug prevents the semicircular canals in your ear from being able to respond to particular movements or head movements in general. The success rate for canal plugging surgery is about 90%. So this was my video about benign paroxysmal positional vertigo. I hope you like this video, and especially do not forget to watch that short video which is just like less than 1 minute video, in which I have told the epley maneuver to treat yourself at home. Okay. If you have any question or comments about vertigo or any other illness, because there are now more than 300 videos about different illnesses on my channel of BPPV, you can see all those videos. And if you want me to make a video about some disease which is which I have not spoken already, you can tell me in your comments. Thanks for watching this video. See you in next video. Bye for now.